On the brinks of Lake Victoria in Kenya, in the eastern part of Africa, the population is living in a climate change hotspot. The global changes in weather pattern has had great impact on this region. Within the past decade, the region has had severe temperatures, unpredictable rainfall, leading to flooding, and frequent dry spells leading to drought. At the same time, the population is rapidly growing, hence putting more pressure on the available resources. One of the problems is high rate of pregnancies among young people who make up almost half of the population, whose knowledge on the use of contraceptives and understanding their sexual and reproductive health and rights is inadequate.
Achako nyuol, pok akomo nyuol. Nyathina mokwongo nayudo ka an gi 22. Bas adhi kamano koro nanyuol ga nen nyuol na nen ga nyuol mapile, nen nyuol ma ok goka. Bas adhi kamano nyaka gin nyithinda 8. Ema koro nachako mondo mi ang'e kaka nanyalo komo nyuol, nikech naneno kata kadak na kodi kata ritruok gi kata sikundgi kata rwakruok gi kata ritruok margi ne ok ber, nikech kata gima natimo malong'o ne onge. But kana chako komo nyuol, bang' komo nyuol ka nyaka nachako gi family. Aneno ka asedhi kodgi maber, anyalo loko anda moro, ginyalo somo maber, ginyalo chiemo, but ginyalo dhi sikul. But anyalo ng'eyo ni koro kata anyalo do pesa na moro mondo mi adhi atim go nyoluoro kod mon wetewa, anyiewo giga duto mana nyalo bedo na onge go. Asedhi maber, ok asekoneno rach moro, nyaka nachak tiyo kod sindan mar komo nyuol.
The communities living around Lake Victoria are highly dependent on fishing and farming for food and income. The result of the increasing population is overfishing, which is not sustainable. Most people do not have the knowledge to do efficient farming, which otherwise could make them less dependent on fishing. Not being able to get enough food or income from either fishing in the lake or farming leads to lower living standards and reduced household income. This means families cannot afford to buy enough food, cover school costs for the children, or buy medicine during illness. The downfall is higher mortality rates for both children and mothers, higher school dropout rate, and malnutrition. According to the Kenya Water Agency report of 2016, the lakeside counties are ranked poorest in forest cover. Kisumu County has a forest cover of 0.44% and Siaya County has 0.42%, far from the national 6.9% and the recommended 10% forest cover. Rapid population is a great concern at 8% growth between 2009 and 2017. 3/4 of the population is below 30 years of age, and poverty prevalence is high, with 40% of the population living below poverty line. Energy is a major concern, as 90% of the population use firewood for cooking and heating, thus creating a huge impact on the environment. With the surging population growth, provision of healthcare is a major concern. The total fertility rate is at 4.3% in the region against 3.9% of the national. Contraceptive prevalence rate is at 53.9%, below the targeted 75%. To counter the interconnected problems of population, health, and environment, 3 organizations have joined forces to enable people to overcome the challenges through the Pambazuko project. Founded in 1957, Family Health Options Kenya is a volunteer-based organization and a pioneer in sexual reproductive health and rights, including family planning in Kenya.
Usually, organizations like ours, we work in isolation to tackle issues which actually are interlinked.
VI Agroforestry is a non-governmental organization that empowers small-scale farmers to improve their lives through agroforestry. For example, through integrating trees in farming systems to to ensure sustainable environment.
We empower the communities to practice different farming methods such as crop diversification, kitchen gardening, and the use of improved crop varieties. We also encourage them to integrate tree planting into their farming systems, which will help increase soil fertility and also help control soil erosion. Trees are also important because of their nutritional values, especially the provision of fruits. They also absorb carbon dioxide from the atmosphere, which help reduce global warming and can also increase rainfall in our area.
The third organization is Community and Environmental Protection Program, or CREP, which works with small-scale farmers on sustainable agriculture and food security.
We got into partnership with other organizations like FHOK Kenya, and we are now implementing an integrated project. And the integrated project basically tries to make the community see the relationship between population, health, and environment.
Unapoiangalia hii shamba, sio maarifa yangu, ila ni maarifa ya mwenzangu from St. Anne's Women CBO Group. Aliponitembelea, tuliketi, akanifundisha vile ninavyoweza kukaa na shamba ndogo na mapato mazuri. Ilinibidi ili niwaweke kwa kikundi au niende kwa mtu ile tujifundishane. Nimefanya hivyo mpaka saa hii. Ukiangalia wenye nimewafundisha kuna tofauti. Naona ubora wa mafunzo yake. Najua haki yangu na tena najua siri ya kupanga uzazi ya kwamba imenisaidia kwa maisha yangu bora na watoto wangu, ambapo najua nitawasomesha vizuri na kuwalisha vizuri, hata afya yangu itakuwa bora zaidi.
The three organizations with different backgrounds have come together to tackle the interconnected challenges in Kisumu and Siaya counties through an integrated model which allows them to use their different knowledge and skills jointly.
People have a right to decide the number of children they desire. And when they space their families or the children, it allows these families to manage their income and also still have some money for food, health, and education. Family Health Options Kenya, a reproductive health organization, is supporting these families to increase their food production by linking them up to sustainable farming practices. This increases the crop yields and soil nutrients, whereby they are able to plant a variety of crops on their farms. And also they're able to increase the health status of the families from different nutrients which are able to be obtained from this variety of crops that have been planted.
Aseberuka puro alot, seberuka puro mananas, seberuka puro poi, seberuka puro rabolo. Do kumela pido mag chak bianu, magik seberuka pido. Gima se konya e puonjruok ni, asepidho alot no konya nikech sani koro kang'iewo alot e chiro. Dhiang' bende sani ok anyal ng'iewo chak e chiro.
Two categories of groups are involved in implementing the project. The first category consists of women and youth groups promoting reproductive health and rights at the community level. They are now integrating information and services on environmental conservation in their work when reaching out to other community members.
Wanifungize, nimekuwa nikitembelea household 100 na naimiza wakina mama wawe wakikuwa na kitchen garden, kila mtu awe nacho. Zamani hapa kwetu kulikuwa kuna choo, mtu tu anaenda tu kwa kichaka then anajisaidia. Naona tangu tupate mafundisho na pia mimi nielekeze kwa mama wenzangu na hata wazee wa vijiji, naona tumemanufanyika sana.
The second category includes farmers, women and youth groups who are largely involved in environmental activities. They are now integrating reproductive health and rights into their daily work. But it is not only for community members to see the benefit of integration of population, health and environment, also called PHE. County and local administration officials are brought on board to improve the lives of their communities.
What I think is that the project has been beneficial to the community. Since before we used to have projects which were mainly dwelling on health issues. But since the PHE was integrated in my community areas, they are able to manage the three health issues, that not health issues alone, but the population health and environmental issues here.
It is not only the local authorities who see the advantages of the project. Lake Victoria Basin Commission is an intergovernmental organization in Kenya, Burundi, Rwanda, Tanzania and Uganda who are helping to spread the integrated approach across East Africa region among government officials.
Lake Victoria Basin Commission is an intergovernmental organization of 5 countries: Burundi, Kenya, Rwanda, Tanzania and Uganda. And therefore, the role of Lake Victoria Basin Commission in the Pambazuko project is to ensure that these countries, first of all, are sensitized, they understand and adopt the integrated approach to sustainable development. If countries can adopt the integrated approach and also give some prominence to the need for this sexual reproductive health and rights integrated with sustainable development, then countries may realize on some of the targets under some of these 17 sustainable development goals.
Using this innovative integrated approach to interconnected challenges, we are training the communities to maximize what they can produce today so that the future generations also have resources to have a healthy and well-educated families. When you achieve access to reproductive health, you reduce the demand for natural resources by preventing unplanned pregnancies. It also increases women's opportunities to participate in economically productive activities. This leads to better economy for the families and for the country as a whole, as it also allows increased tax income. We will not only have more healthy citizens, but also citizens who are active in their communities and informed on their health and environmental rights. By addressing population, environment and reproductive health and rights issues for the community, then Kenya will be assisted to meet her development goals.